Okay, thank you very much. Are we okay, Paul?
Yes, go ahead.
Okay, great. Thank you, Dr. Ron, for that introduction, and thank you very much for letting me attend by Skype. It really helped my schedule. I've been traveling so much. What you'll see in this slideshow and my presentation is that I'm making magnesium out to be the most important nutrient. And I know I'm speaking to an audience that probably feels vitamin C is the most important nutrient, but I think together they can work miracles. I know magnesium alone works miracles, and I've seen vitamin C work miracles. I titled the talk, Therapeutic Magnesium is a ReDox Miracle. And as Dr. Ron said, I wrote the book, Magnesium Miracle. It's coming into its 2017 edition, and it's gone up a few more hundred pages as allopathic medicine itself is starting to look into magnesium, and as more and more research is being done. So with oxidative stress research, we do have all the specialties starting to work together: chemistry, biochemistry, cell biology, physiology, pathophysiology, medicine, health and disease research. But what they'll be doing is looking for drugs to treat oxidative stress. And we all know that drugs create oxidative stress. And of course, the downside is they're just looking for funding. So everyone is fighting for the research funding. The factors in detox medicine where it interacts with the magnesium deficiency are the excessive oxidative damage is implicated in multiple disease processes as well as aging, as is magnesium deficiency. And then magnesium is an excellent antioxidant. We know that. Nitric oxide being very pivotal in controlling vasodilation. It's pivotal in the redox reactions, but its activity is under the direction of magnesium. We hear a lot about mitochondrial dysfunction these days, impaired function with decreased respiratory capacity, etc., linked to the development of insulin resistance, obesity, type 2 diabetes. But when you look at what's happening in the mitochondria, that's where a lot of magnesium I could say is stored, but mostly magnesium is in the mitochondria to perform its functions in the Krebs cycle. Magnesium is required for 6 of the 8 steps in the Krebs cycle, and magnesium deficiency is a sign of diabetes. So with decreased ATP synthesis, you start getting this symptomatology, this insulin stimulated glucose uptake is affected, secretion of insulin from the beta cells is affected. This is a very important slide. I hope you all get a copy of the slides because it shows you the 6 steps in the Krebs cycle that require magnesium. And I know as I said, we've all heard about mitochondrial dysfunction, and people are putting out products for the Krebs cycle and to enhance mitochondrial function. And I never see magnesium mentioned, whereas the biochemistry clearly states how important it is. Yes, I've mentioned it's a cofactor in 6 of the 8 steps, Krebs cycle. And we know magnesium deficiency causes inflammation and systemic stress response. 80% of the population is deficient. The USDA confirms that, US Department of Agriculture. In rat studies, low magnesium causes release of substance P with increased inflammatory cells, cytokinins, ROS depleting antioxidants associated with cardiomyopathy. Magnesium deficiency leads to fibroblast aging, and inflammation caused by opening calcium channels and activation of NF-κB is prominent. The high fructose diet and low magnesium sets the stage for oxidative stress, insulin resistance, and metabolic syndrome. You see, I'm sure I have a slide further on about this, but magnesium is responsible for 700 to 800 enzymatic processes in the body, not just the 325 we've been hearing about since the 60s. It's really that many processes. Zinc, I think, is responsible for about 180. So magnesium, from head to toe, it is responsible for just about every metabolic function in the body, or it's associated with every metabolic function. So when you get oxidative stress, as this journal article indicates, increased oxidative stress produced in the mitochondria and cytosol of the heart and brain is a common denominator to almost all cardiovascular and brain diseases. A particular mitochondrial protein and family of enzymes regulate the aging process and determine lifespan of many species and are involved in cardiovascular diseases. The best way to reduce oxidative stress in the mitochondria, heart and brain, and to ensure efficient mitochondrial function is to saturate the body with therapeutic levels of magnesium instead of a fruitless search for a drug. The functions: energy production, membrane stabilizer, protein production. They're looking at the magnesome now. They went from the genome to the proteome, looking at protein production, and find that there are 3,751 magnesium receptor sites on human proteins, and that's only part way through their research. RNA and DNA, magnesium was required for the structural integrity of nucleic acids, glucose tolerance factor, GTP cofactoring, and all the signal transduction, everything we're talking about now in terms of energy medicine and epigenetics and metabolism. Magnesium is right there helping the body exist through all its metabolic functions. And then, phospholipase C cofactors, cyclase cofactors, and the 700, 800 enzyme processes, regulates ion channels. That's very important. When you talk about mineral ion channels allowing calcium to go in to create an action potential in the muscle and the nerve, magnesium regulates that ion channel, allows calcium to go in and then pulls calcium out. If you don't have enough magnesium, the calcium stays in and keeps up a rapid firing that can result in cell death. Intracellular signaling, we're talking about that a lot. Nitric oxide is also involved, as is magnesium. Oxidative phosphorylation, especially in the production of ATP. Nerve conduction. Muscles and nerves are what we mostly think about with magnesium, but that's 13 and 14 on this long list. We know about muscle function in terms of if the heart muscle does not have enough magnesium, it goes into spasm. And the highest amount of magnesium in the body is in the heart. So it's critical, as I mentioned, in all these areas: energy, protein synthesis, membrane integrity, hormone secretion, intermediary metabolism. A lot of text now, a lot of journals are writing about magnesium. It's almost as if there's finally been enough research that people are sampling the research and saying, oh yeah, magnesium is very important. And I'll be getting to this later, but what happens with magnesium is that unfortunately most of the research has been done using magnesium oxide. Magnesium oxide is only 4% absorbed, So it becomes a great laxative for people. It actually starts flushing out their magnesium instead of supporting their magnesium stores. So doctors are getting the right idea about magnesium, but then they don't know how to treat magnesium deficiency. I bring up this magnesium and cell signaling. There's an article by Burton and Bella Altura, a very long journal article actually, that talks about the research that these doctors have been doing for 20 years. And years ago, they hypothesized that magnesium ions function as extracellular signaling in cardiovascular pathobiology. This is an article everybody should read. You can get it freely on the internet. Short-term magnesium deficiency downregulates telomerase, upregulates neutrals, sphingomyelinase, and induces oxidative DNA damage in cardiovascular tissue. Relevance to atherogenesis, cardiovascular disease, and aging. I've noticed a lot of the magnesium researchers, they try to put everything in their title because magnesium research is often pushed aside because the focus is on drug therapy. Now, I went through the manifesto that you all are observing at the conference, and again, I slightly apologize that I'm putting magnesium as the answer to what we're dealing with in terms of oxidative stress and the lack of antioxidants. So with the exploring the underlying causes of chronic disease, I think Dr. Ron mentioned, of course, I'm especially interested in magnesium deficiency, but also in yeast overgrowth, where intestinal yeast can produce 178 different yeast toxins. Those toxins are absorbed through a leaky gut, absorbed into the bloodstream, and create head-to-toe reactions in the body that are very much overlooked by allopathic medicine and even alternative medicine, because there's no pill to treat yeast overgrowth. What I've observed most lately is there's a focus on the microbiome, and that's wonderful. We're looking at intestinal imbalance of organisms, but the focus constantly is on bacteria. There's hardly any mention of yeast overgrowth, Candida albicans. So again, we're kind of missing an important aspect of the intestines if we overlook yeast. The manifesto goes on to say, with the intent of elucidating new ways to treat disease in non-toxic fashion, and I'm saying it's oral therapeutic magnesium, chronically ill patients. Again, oral non-laxative magnesium is a powerful therapy, and I'm saying it's more accessible to people than intravenous vitamin C. Obviously, you don't have to go to a doctor, you don't have to have a needle in your arm or pay for IV treatment. So I've always been very interested in offering people non-toxic, affordable care that they can take responsibility for. My mission is to put treatment in the hands of the patient, and this antibiotic resistance, all the chemotherapy, the focus that has gone directly toward drug therapy. I went to medical school in the mid-70s, and at that point I was already interested in nutrition and alternative medicine, and I thought certainly within the next couple of decades that everybody would understand that we had to eat a good diet and exercise and take care of our lifestyle and use nutrients. But that was completely overrun, especially when drug companies were given the go-ahead to advertise drugs on television. I don't think we realize how that changed everything for medicine, where patients could be diagnosed on a TV commercial, go into their doctor and demand a drug. And what's happened is the side effects from drugs, the major side effect, I think, is creating magnesium deficiency. That is leading to all these disorders. Yes, I'm saying oxidation is winning in an environment of magnesium deficiency and yeast overgrowth. The focused here, the oxidative stress focus, I'm saying magnesium is a superior antioxidant, anti-inflammatory, redox reagent, and cell signaling agent. And I'm pushing, repeating myself many times here about magnesium deficiency and chronic yeast overgrowth as the root causes that I've come up against in my 40 years in medicine. And putting down the hidden dental affections, yes, that's huge, and it's certainly not addressed by medicine. The nutrient deficiencies, the minerals are not in the soil, the food is overprocessed, overcooked, so the vitamins are deficient as well. Leaky gut, I'm saying that's coming more from yeast overgrowth and the overuse of antibiotics. Anytime anyone has any surgical procedure and a lot of dental procedures, they're given antibiotics. It's not just people walking in with their colds and flus demanding antibiotics. It is given chronically and constantly. Environmental toxins, hormone disruption, epigenetic imbalance, polypharmacy. And I'm saying calcification is another huge factor. And I was happy to see that Dr. Levy did his breakout session on death by calcium. I love the title. I wrote the book called Death by Modern Medicine. So I agree with the title. And what's happening with the oversupplementation of calcium, it pushes out your magnesium, it causes a greater need for magnesium. And of course, we've got coronary artery calcification, carotid artery calcification, and kidney artery calcification. I think we're forgetting kidney artery calcification as the cause of chronic disease and kidney failure. I think the failure there is the failure of medicine to take care of patients so that their kidneys don't fail. But because you can't go in and do surgery for kidney artery calcification, it's not mentioned, and people just don't talk about being able to treat it. They just treat the end result. And as you all know, when people have any sort of kidney disease, they're just told to avoid magnesium. And this business about magnesium being problematic in kidney failure is, I mean, there is some truth to it, but I think that's because of intravenous magnesium being used in a hospital setting, and people who have kidney failure, they would develop high levels of magnesium and then magnesium-induced arrhythmia, whereas magnesium, for the most part, will treat arrhythmia. And I've proven that so many times with people having atrial fibrillation who take a good absorbable magnesium, and their symptoms abate. So that the people who have magnesium deficiency atrial fibrillation are treated and treatable with magnesium. So with the kidney artery calcification, I'm saying that if people can be saturated with magnesium, they actually can dissolve some of this kidney artery calcification, just like magnesium can help dissolve and prevent kidney stones. Breast tissue calcification, this is a huge disruption in women's lives. Women who take a lot of calcium, the calcium is for the most part only about 4% absorbed. So the rest of it, it creates constipation. It does deposit in soft tissues, atherosclerosis, kidney stones, heel spurs, gallstones, and breast tissue calcification. And it's being misdiagnosed as DCIS, disseminated intraductal carcinoma in situ. And what it is just calcium showing up on a mammogram, which a doctor must prove is not carcinogenic, with more mammograms and biopsies. And they even talk about curing DCIS with their biopsies, whereas the literature says it's a almost a pre-cancer, but it thoroughly disrupts the lives of the women who are diagnosed with breast tissue calcification. This is an important aspect of magnesium deficiency, the fluoride drugs. Fluoride is in many of the drugs that are being prescribed these days. I'll show you some of them. They do make up the majority of commonly used drugs. Fluoride is added to drugs to increase the ability to cross fatty cell membranes, making the drugs more potent, more powerful. And many cardiovascular side effects occur in different classes of drugs because of the fluoride. And magnesium deficiency symptoms are often treated with fluoride drugs, which makes the deficiency worse. Now, I've spoken to doctors who say, well, these fluoride drugs, they don't break down in the body. That's just not going to happen. But as they say, in a petri dish, a fluoride drug may not break down, but intestinal organisms can break them down. That's what they love to do, and release the fluoride molecules. Cipro, you all know about that. It's got warnings for tendon rupture. And what happens when the fluoride molecule of Cipro binds with magnesium, you create a brittle compound called magnesium fluoride. This brittle compound deposits in bones and tendons and cartilage. So the side effects you get with Cipro reflect that: muscle pain, tendon rupture, and atrial fibrillation. Prozac has 3 fluoride molecules. Side effects: tic, spasms, neurological agitation, all magnesium deficiency symptoms. Paxil, 1 fluoride molecule, same types of side effects: spasms and tension and palpitations. Lipitor, it has well-known muscle cramp, pain, stiffness side effects apart from rhabdomyolysis. A lot of the doctors and drug companies who support statin use say, oh no, rhabdomyolysis is very rare. It only occurs in point whatever percentage of people. And they totally ignore the 10% of people that experience muscle cramps, pain, and stiffness and tachycardia, for which they're given anti-inflammatory drugs, which drain more magnesium. This is my least favorite fluoride drug. It's antiarrhythmic. It's very commonly used. It has 6 fluoride molecules. Its side effects are fast, irregular pounding, racing heartbeat or pulse, shortness of breath, wheezing. Asthma is another indication of magnesium deficiency, and that's because the smooth muscles lining the bronchial tracts can go into spasm and cause shortness of breath and wheezing. And flecainate also causes burning, crawling, itching, numbness, prickling, pins and needles or tingling feelings, and chest pain. If you've ever had patients who've said, I've never been well since surgery, they could be suffering from magnesium deficiency symptoms created by their the drugs given during surgery or by their inhaled anesthetic. Desflurane also has 6 fluoride molecules. Its side effects are bradycardia, hypertension, arrhythmia, and tachycardia. I've had a lot of people come to me who say their arrhythmia develops in the hospital. Prevacid 3 fluoride molecules. The FDA has finally put a warning on the protein pump inhibitors that they cause low serum magnesium levels. And serum magnesium, it's hard to get that low because the body has a feedback mechanism where it'll keep pulling magnesium out of the storage sites in the bones and muscles to make sure the serum magnesium stays at a normal level to protect the heart. And that's the reason why doctors don't recognize magnesium deficiency. They totally ignore it because they do their serum magnesium tests, or they used to, and they're always normal because the body compensates. You all know in an electrolyte panel, you do not see magnesium levels drawn. Diflucan, I'm big on yeast treatment, and a lot of people say, well, what if I just take some Diflucan? It has 2 fluoride molecules and has a lot of magnesium deficiency side effects. And then the Celebrex that people take for all the magnesium deficiency, muscle pain, and spasms has 3 fluoride molecules. The Flonase has 3 fluoride molecules, as does Advair, an asthma inhaler. So there you have fluoride, in your nasal passages, causing a lot of side effects. Solution: wean off your meds, substitute a non-fluoride medication. As people take more magnesium for magnesium deficiency conditions, they need less drugs. So most of the people who get saturated with magnesium find they don't need their medication, and they go to their doctor to help them wean off these drugs. So my manifesto is we can heal most of our chronic diseases with ReDox medicine, ReDox therapy. I'm saying the IVC community should spearhead this work, that don't let it be taken over by the universities and the hospitals. And my treatment of choice, as I've mentioned many times, is oral magnesium. And what I've realized over the years, actually just to backpedal a little bit, I wrote the Magnesium Miracle book without knowing, or before I knew I had magnesium deficiency, heart palpitations, and leg cramps, Charlie horses. It wasn't until Random House asked me to write the book, and then doing the research, I realized I had severe deficiency. And then when I started to take magnesium treatments, magnesium pills and powders, I immediately get the laxative effect with any sort of magnesium that I take. I was reduced to doing Epsom salts baths and magnesium oil spray to try to keep my levels up. And what I did, what I've done for the past 10, 15 years is try to find a company who would make a non-laxative magnesium. But I'll go back to this magnesium blood test slide before I get to the types of magnesium. The serum magnesium test is useless because only 1% of the total body magnesium is in the bloodstream. Ionized magnesium test is the most accurate. However, there are only 140 of the 5,000 labs in the US that do the test. So it's research testing, and some hospitals have the test. I think it's very important that doctors push their labs for this test. It can be done. They do ionized calcium testing, but they ignore magnesium. The next best test, although it's not great, is RBC magnesium test. Patients, consumers can order it themselves online. $49 for the test. They get the results in 72 hours. So it's less than a copay for most patients. So I send people for that. Problem is the red blood cells don't have mitochondria. Therefore, they don't have the amount of magnesium that other tissue cells do. So it's really not a great test. I get people to do it and try to educate them and say, get the test before you start magnesium therapy, and then observe it to see if your levels increase. And as Dr. Ron has observed in his clinic, the first 3 to 6 months, your RBC magnesium levels may drop. Why is that? It's because the 700 to 800 different enzyme systems start grabbing all the magnesium they can, activating all those enzyme systems, giving you more energy, giving you so much positive processing in your body by using this magnesium that it's all used up and you need more and more and more. So the first, as I said, 3 to 6 months, it can drop, but then by about 18 months, people are mostly saturated. It took me about 18 months when I started using my own non-laxative magnesium to get saturated. Optimum levels, I'm saying, are 6.0 to 6.5 milligrams per deciliter. The range is 4.2 to 6.8. So why do I say 6? It's because the ranges in labs are based on the average population, the people that walk in the door. So you've got a bell curve. And if 80% of this average population is magnesium deficient, you want to be above that 80th percentile in your magnesium levels. Now, it's kind of hard to get that across because, you know, doctors just look at the red flag, and if it's too low or too high, they're not really looking at optimals. And what I've noticed in the past year is the range in some labs is dropping to 3.8. So the population is getting more and more deficient, yet doctors are assuming that 3.8 is within the normal limits. So there's a patient in front of them, you know, the eye is twitching, you know, they're tensed up, they're not sleeping, they're having heart palpitations, their legs are cramping, they have heartburn, they have all these symptoms of magnesium deficiency, and the doctor says, oh, your magnesium levels are normal. Ionized magnesium testing must be promoted. This quote is from the journal article I mentioned that the Alturas were responsible for writing, and they actually created the ionized magnesium testing. And they've done, you know, maybe 100 studies using ionized magnesium testing and help to really solidify the magnesium research field and show that magnesium deficiency is responsible for dozens of chronic conditions, and magnesium treats all these conditions. How much magnesium? The RDA is just to make sure, it's partly to make sure you don't have magnesium deficiency symptoms, but these are very much ignored. But it's set low for the people who have the laxative effect with magnesium. They're trying to avoid people having diarrhea with magnesium. Now, what's interesting about the laxative effect with magnesium, it's actually the fail-safe of magnesium. It makes it the safest nutrient to use, because if you take too much, even of non-laxative magnesium, if your body's saturated and you don't need any more, you will get the laxative effect. It's an evolutionary device in the body where humans grew up around the ocean, and the ocean water has 3 times the magnesium as it does calcium. So what happened, you know, back in history, we didn't have dairy products. We didn't, you know, they didn't have cows. So they had to get calcium from fish bones and green leafy vegetables, nuts, and seeds, wherever they could. So a mechanism was developed in the body, which is vitamin D, to pull calcium into the body and hold on to it. And a mechanism was developed that if you eat too much seaweed and fish and sea vegetables, that you'll get the laxative effect if you have too much magnesium. So what have we done in the past couple of decades? We've overdosed calcium, and now we're overdosing vitamin D. You've all seen people come in with their 50,000 units of vitamin D, and as Dr. Ron said, not a lot of people realize that vitamin D can be problematic. When you take high amounts of vitamin D, you pull in calcium, and that excess calcium bumps magnesium. As soon as the high vitamin D fad started, I started getting emails and calls from people who said, I was just fine on my magnesium for my heart palpitations, my migraines, my seizures, and then my vitamin D levels, my doctor wanted me to increase them. So he or she gave me high dose vitamin D, and all of a sudden, all my magnesium deficiency symptoms are back. Magnesium is required by the storage form of vitamin D or the supplement form of vitamin D to activate it, to transform it into its active form. So the more vitamin D you take, even sunshine for some sensitive people, the more vitamin D you take and have to activate it, it pulls your magnesium. It just overuses your magnesium and you become deficient. Same with calcium. Personally, if I eat yogurt 2 or 3 days in a row, that's too much calcium for my magnesium intake, and I start developing my heart palpitations again. So the body can be very sensitive to these mechanisms. I'm saying about magnesium, we need twice the RDA. 100 years ago, we could get 500 milligrams in our diet. Now we're likely to get 200. And what I think I talk about calcium, maybe not. I say for calcium, 600, 700 milligrams instead of the 1200, 1500. If you look at the World Health Organization, even in the UK, their RDA recommended dose of calcium is 500 to 700 milligrams. And I'm also saying that a lot of people can get their calcium from their diet. And if they don't take dairy, they can make bone broth or buy bone broth. There are a lot of ways to get calcium. If they can't do that, then go for liquid calcium supplements that are highly absorbed and not the calcium carbonates or most of the calciums out there that are only about 4% absorbed. I'm working on a liquid calcium formula as well. Magnesium sources, Epsom salts baths. Sometimes I discuss with people taking magnesium, but they're on all these medications and they're afraid to take a simple nutrient. So I said, okay, put yourself in an Epsom salt bath. 2 cups in a bath, 1 cup in a foot bath. I've mentioned a couple times about magnesium oxide only being 4% absorbed, but that, I think it's got 70% of the market share of magnesium sales, magnesium oxide. Magnesium citrate powder and liquid is good. The chelates, glycinate and taurate, there's an expense to them that may outweigh the fact that they may be 20% absorbed. What I've created, as I mentioned earlier, for my own health is a picometer stabilized ionic magnesium. So there's a size here that's involved. The size of the plant rootlets that allow the absorption of minerals is picometer in size. And that's the same size as the cell mineral ion channels in the body. So size is important, but I think what makes ReMag very unique is a proprietary process that stabilizes the ions. because what you have in any liquid of a magnesium chloride solution, which is where ReMag comes from, the magnesium and the chloride will dissociate and then bind together back and forth and back and forth. That's only natural with these compounds. But to stabilize the magnesium gives you a time frame so that that magnesium has a chance to be absorbed into the cells, absorbed fully at the cellular level. Transdermal magnesium can be helpful for some people, especially if you've got injuries, aches, or pains. I tell people to spray ReMag liquid, as well as you can use transdermal magnesium oils and gels. A lot of those are very irritating for the skin and hard to use long term. I've talked about the ReMag. I didn't realize when I was doing it how powerful it was. And it's only been in the past couple of years that I've had ReMag that I've established that it's a way to get therapeutic magnesium. And it's now being recognized by people who are using IV magnesium because they too have the laxative effect with magnesium, but if they don't have magnesium, they have severe symptoms. So they've moved from IV magnesium to oral magnesium. So I'm recognizing with the treatment of atrial fibrillation, very severe heart disease problems where people are on a lot of medications, that once they build up therapeutic levels of magnesium, their magnesium deficiency symptoms abate and they can wean off their medications. After I created ReMag, I realized, people really need to have a balance of all the minerals. You can take too much of a good thing. One thing I tell everybody to do is have enough water intake, and in their water take a quarter teaspoon of sea salt or Himalayan salt in every liter of water. And you start to remineralize and hydrate your cells when you start taking sea salt. What happens in the cells is they require minerals and the cells require water or fluid. When you take enough minerals, then the minerals find their way into the cells and pull water in after them. It's an osmotic process. And when that water gets into the cells and hydrates the cells, then it doesn't fall to your ankles. You don't have the tissue edema that you do if you're dehydrated. And the unfortunate thing in medicine is patients are being told not to eat salt and to take diuretics and to limit their fluid intake to like 3 and 4 cups of water a day. And this is just, it's just horrifying because we have severe cellular dehydration and symptoms of dementia and senility that are caused by brain cell dehydration. What's interesting about my ReMyte formula, again, it's stabilized ionic minerals. 9 of the 12 minerals in ReMyte support thyroid function. And this is so important because we have an epidemic of thyroid deficiency, hypothyroidism, Hashimoto's now. So what allopathic doctors have done for decades is give thyroid hormone replacement, synthetic thyroid hormone replacement. And what do alternative doctors do? They say, oh no, that's bad. We have to give natural thyroid replacement, Armour thyroid, nature's thyroid, etc. I'm saying let's pull it back even further and give the thyroid the 9 mineral building blocks that's required to produce thyroid hormone. We know iodine is important, and unfortunately, people are using high dose iodine, which starts a process in thyroid hormone production that builds up too much in a certain pathway. If you don't have selenium and zinc in the pathway, then you start to I don't know if it causes the reverse T3 phenomenon, but it starts to cause receptor blockage. So what I personally found, I'm my best guinea pig. It seems I was on Armour Thyroid 60 milligrams for many years. 2 months into trying out my ReMyte product, I found my pulse a little elevated. I was even a little more hyperactive, a little more edgy. So I stopped my Armour Thyroid. Yes, I should have weaned off it, but I didn't. I stopped my Armour Thyroid and I'm fine. You know, you can feel my hands are nice and warm and I feel great without my Armour Thyroid. So yeah, it's important to get the right building blocks. I have 10 minutes. What I could do is show you my magnesium deficiency quiz. I could show you the magnesium deficient conditions or my gauging magnesium deficiency factors. But I do think you have all that information in your handout. So I'll go back to you, Dr. Ron, and see whether or not we have any questions on the floor.
Let me see if there are any questions from our group of about 170 fine doctors.
Wonderful, wonderful.
Have you ever seen magnesium?
Have you ever seen magnesium cause heart palpitations?
I briefly mentioned in hospital settings, doctors have, you know, they overdo things often. Yes, it can cause heart palpitations. In the oral use of magnesium, I sometimes see it where people are very deficient. We know they need it, but it kind of stirs things up. And I just tell people to cut way back and go very slowly. The other thing that can happen to sort of cause it appears magnesium-induced heart palpitations is if magnesium is supporting the thyroid and kind of triggering extra thyroid activity.
Yeah.
So that can happen as well. And with my putting people on my ReMyte to support their thyroid, sometimes they'll say, oh, you know, it stirred up my heart palpitation. So again, you just have to pull back and go slowly. People tend to say, oh, you know, the magnesium or this or that is causing side effects. It's not causing side effects. It's causing effects in the body related to a person and their level of toxicity, their level of magnesium deficiency. So I have people who are so toxic, as soon as their liver enzymes are supported with magnesium or their glutathione is supported with other, you know, the selenium minerals, they start detoxing and they just can't take it. And instead of them giving up, I say, look, we know what's happening. That's what they want to know from their doctor. Look, we've seen this before. We know what's happening. Just really go a lot slower. You've got all the time in the world, but if you stop and start treatments and sort of dive into a treatment too fully and start causing detox, then they're just going to quit and not want to start again. So, yeah.
We have run into that many times, and so I now hand out a 5 cc syringe with the ReMag and have them start at just 1 cc or even as low as a half a cc and very slowly work up. Is there a top limit to ReMag that you're aware of that we should have people go?
I have my people who've been on intravenous magnesium, they're taking 4 and 5 teaspoons. I don't like them take that 5 teaspoons, that's 1,500 milligrams. But if they're not having the laxative effect, that means they're urinating a lot of it out and using the rest. But I really try to get them on not matching levels of ReMag, but ReMyte. For example, with 3 teaspoons of ReMag, I want them on 1.5 teaspoons of ReMyte and the salted water. Personally, to get rid of my heart palpitations, I was using 3 and 4 teaspoons. After 18 months, I only needed 2 teaspoons, 600 milligrams. And right now, actually, I'm trying a capsule form of ReMag. And so far, it's been a week. I've been doing 600 milligrams of this capsule form of ReMag and no laxative effect and no heart palpitations. So it's going to be much easier for patients who, you know, don't want to drink a strong tasting mineral.
I have a question here regarding the fluoride definitely causing the body's magnesium to deplete, but are you aware of any published data on that that could be used? Because very often we're fighting the fluoride wars around here, and it'd be helpful if we could have some data or a reference that we could use that fluoride does deplete magnesium.
No, I'm afraid I haven't. I've been in dialogue with some folks about this, and the closest we got was to say, well, the intestinal flora are breaking it down, so there's our...
Okay.
Yeah. And people looking at the microbiome now and a big focus on the intestines, I think people will accept that.
Yeah.
Here's a question that I know you'll know the answer to. What is the relationship between stress and magnesium?
Well, it can be even from the tightening of the muscles. It can be the adrenal glands really burning off the magnesium. It can be so many levels. And stress is such an overused word now. Any form of physical, mental, emotional, any sort of stress will burn your magnesium. It's, you know, it's totally related.
Yeah.
Julian Whitaker referred to diabetes as a nutrient depleting disease, and I know that excess sugar in diabetes depletes magnesium. Does it have its effect at the renal tubules, or how does excess sugar affect magnesium?
Well, with diabetes, you know, the excess urination is pulling out your sugar as well as your electrolytes. Your magnesium leaves in the urine. But there's a Dr. McBride wrote a book about, it was a leaky gut type of book. I'm blanking on her title right now. But she said that it takes 28 molecules of magnesium to metabolize 1 molecule of table sugar, and 56 molecules of magnesium to metabolize 1 molecule of fructose. So where the high fructose corn syrup came into play and started to really push the obesity epidemic, I think that sugar uses up magnesium. The body's trying to get rid of it.
And
maybe in the Krebs cycle, if you're just the plain metabolism of excess sugar, may result in depletion of magnesium reserves.
Good, yeah.
Someone has asked, how do you grade your magnesium deficiency quiz?
Just by how, not in numbers. I just use it as, it's like a show and tell. Are you drinking soda? Well, then you got a problem. I mean, it's almost like, I know everybody's deficient, everybody can use it. So it's just to give you some idea that, yeah, you know how patients are. They'll say, well, do you mean pastries have sugar in them? They really don't understand, you know, exactly that you mean everybody. So I'm not going to put numbers on it. And you can't, I mean, it's so impossible to really gauge where people are at with their magnesium deficiency. You have it working on 700, 800 enzyme systems. You have a human being on half a dozen drugs, with their stress, with their history. Athletes, you know, you have these athletes who, after a few decades of simply sweating out their magnesium, they have all the symptoms of a person with chronic diseases that you just don't expect it. But if you look at magnesium as the culprit, then it just makes sense.
Yeah, you can
look at a patient clinically and pretty much tell that they're magnesium deficient, but then the challenge is to convince them that they need to change their behaviors and possibly take more magnesium in order to get there. But then you have to start low and build slow. So it's a bit of a challenge to get magnesium to a therapeutic stage.
But it's so much more simple, I find, to than to say to someone, look, you have all these problems. Here's 10 bottles of supplements, and call me in the morning. But with magnesium, you can say, take an Epsom salt bath. If it makes you feel better, you're on the right track. And then here's something that works. And I call it, sort of the gateway drug to get people, more in tune with their body. They start feeling better and they say, hey, I might be able to get off these meds, because the psychological burden of people being on medications for anxiety and heart palpitations caused by magnesium deficiency, I think is criminal. So once they get a sense that, oh, I'm getting a bit better, and they can wean off these drugs, it's, you see all these people. I mean, we're all doctors of last resort, and to have one thing that you can give them that makes a difference, it really helps their confidence about getting better.
Here's our final question.
We're just about out of time, but I think it's a good question. You once told me that if you put a patient on ReMag and they actually used it, that when you saw them back, if they weren't better, you were surprised. Is that still your feeling about this in terms of all these years you've been using
this therapy?
It is. And on my radio show every Monday, I run into this where people say, well, I've been using it and I'm still not better. Then you say, how much are you using? They're only using maybe a maintenance dose, and they're still on medications, and they just had, a major stress. And you just go down the list of possibilities. And then, at the end of the conversation, oh yeah, right, I'm not taking enough. Because people will say, well, I'm taking a quarter teaspoon and I'm no better. So it really is, patient education and communication, and just being so convinced as I am that magnesium will work, and the reason it's not working, I never say it's a patient's fault, but there is a reason why it's not working. So let's dig deep and find out. You see, people get so frustrated. I have young mothers, two of them recently, actually, with 4 children, and they both had similar symptoms where they just started developing anxiety because they were so magnesium deficient and stressed out, and then tingling, nerves tingling and irritation. And one of them, when she was 75% better, she didn't say, oh, great, I'm 75% better. It's only been 4 weeks, I'm going to be all better within a few months. She started looking for reasons why she wasn't 100% better. And she just drove herself crazy, got told, oh, maybe you have Lyme disease, took 3 months of antibiotics and made herself even sicker. So it's people just being impatient and desperate. So the more you know as a clinician, the more you know about magnesium and how beneficial it can be and have a safe source, then the more confident you can be and pass that on to your patients.
Right.
I should tell you that we put magnesium in every IV vitamin C that we give, so I've often wondered which is doing the most good. I'm sure they're very synergistic together.
Yeah, good point. And yes, I did want to say I've never seen studies using intravenous magnesium for cancer. So I doubt if magnesium is ever going to, reach the mark that vitamin C has.
Yeah.
Well, thank you, Carolyn, so very much for taking time out of your busy schedule. Oh, one more question, sorry.
Dr. Ron, I just wanted to give a little pearl with mag and magnesium. I'm still a very active practicing OBGYN, and we now have to, we're highly recommended by the American College of Obstetrician and Gynecologists and the American Academy of Pediatrics to give any patient that is going to probably deliver before 34 weeks IV magnesium, at least 12 to 24 hours IV, because of the neuroprotection for the newborn fetus following preterm delivery. Also, it is our #1 choice for tocolysis for preterm labor. So it's not FDA approved for that, but we use it as a 6-gram bolus, and we run it about 2 grams an hour, depending on the BMI. So magnesium in that way obviously has a lot of benefits for pregnant moms as well as preterm delivery.
And I was wondering, I've always wondered if
Magnesium
deficiency
wasn't the cause of preeclampsia, you know, the mystery illness. Is it just simply a magnesium deficiency?
Century ago. And yeah, it's unfortunate that they only use IV magnesium at the preeclamptic, eclamptic stages rather than really promoting it during pregnancy. Yeah, I think you're right.
Okay, I think we're
One, okay, this will be the last question, sorry. Yeah, one more question.
Okay, I do addiction medicine. One of the things I'm focusing on is NMDA receptor antagonism. That's what causes the acute withdrawal symptoms where they go into profound sweating, muscle cramps, diarrhea and stuff. And I am finding the way it is working is the hyperpolarization because of calcium inside the cell. And when you do magnesium and glycine, it counteracts. And there is an NLM article that says per pound, if you do 30 milligram per patient, their symptoms reverses. So let's say if they are 100 pounds, you would do 3 grams. And with glycine, I found if I do trimethylglycine, if they have methylation issue, I found that combination works very well in controlling the detox symptoms. You guys, have you heard about the NMDA antagonist, like viral infection now, viral encephalitis and stuff, which mimics drug addiction, withdrawal? So you have any opinion on that?
I didn't really catch that. Can you summarize?
Well, I'll summarize. It's
Basically that NMDA issues are tied in with addiction and calcium, and that using magnesium can, and glycine, which is a very important methylating agent, it can help facilitate a better recovery from addiction.
Very good.
Very good.
Very good.
I'm just going to say very good. Thank you so much, Carolyn Dean.